Good afternoon, everyone, and welcome to our Facebook Live. Today, we're at the former site of HealthWorks on Industrial Road here in Tupelo. And while it's quiet here today, that's not always the case. And that's because North Mississippi Medical Clinics is now offering COVID-19 vaccines here in this building on designated days each week. And joining us today is Dr. Bonnie Basler of West Tupelo Medical Clinic and Urgent Care. We're going to be talking about vaccinations and try to answer any questions that people might have. Thank you for joining us, Dr. Basler. Let's start by just talking in general about what this year has been like for you as a clinic physician and why you were so glad to see the vaccine become available.
Deborah, it's been a year like no other. There's been so much suffering. We've lost so many wonderful people to COVID, but things are getting better in large part due to the vaccine. We're so thankful. It's such a blessing that we already have a vaccine that's this safe and effective.
Right, good. And at first, the vaccines were very limited to certain age groups, but now pretty much anyone who wants the vaccine can get it. Is that right?
That's right. Currently in Mississippi, anyone 16 or older can get the vaccine free of charge. If they're less than 18, they need to bring their parent with them to get the vaccine, but yes, anybody 16 or older, and if they've had another vaccine within the recent past, they just need to wait 2 weeks, and then they can come get their COVID vaccine.
Okay, great. So there aren't a lot of limits then.
No, that's right.
Great. What about people who've already had COVID? Do they need the vaccine?
Definitely. If you've had COVID, you definitely still need the vaccine. It's going to be better coverage and more long-lasting coverage. We just ask that if you've had the monoclonal antibody treatment that you wait at least 90 days from that time. And if you've had COVID but not the monoclonal antibody, let's just wait 60 to 90 days before you come get your shot.
Okay, good to know. And there's still a lot that we don't know about COVID, but we have learned a lot over the past year. So I'd like to talk in general now about the vaccine itself. How does the vaccine work?
Well, the COVID vaccine works very much like other vaccines that we're all familiar with. It shows your immune system just a tiny little part of the germ, and it primes your immune system so that it's ready should you ever come in contact with the virus again.
Okay, good. And can it give me COVID? Can the vaccine give it to me?
No, the vaccine absolutely cannot give you COVID infection. That's a great question.
Good to know. How effective is the vaccine?
Well, we're currently giving the Pfizer vaccine, and as you may have heard, it's at least 95% effective in preventing severe disease.
Good, 95%. That's awesome. How safe is it? We hear a lot of questions about that. How safe is the vaccine?
Well, we have 6 months of experience now, and through that time, there's been absolutely no serious effect, no serious safety concerns during 6 months of follow-up.
Good, good. And I know that some people do have side effects, though, when they get the COVID-19 vaccine. Can you talk a little bit about what someone could expect as far as a side effect?
Yes, well, all of the side effects, most all of the side effects we're seeing are actually reassuring because they let us know that the vaccine is working. My second COVID shot, for example, I had the sore arm, and just for one day I had chills and aches, but I was fine. I didn't require any medicine for it, and I was still able to work that day.
Good to know. Why should I take the vaccine now? Should I just wait, or, if I'm not high risk, what's the hurry?
Right, good point. We're getting that question some, but even if you're not high risk, your contacts are high risk, and you are at risk. We've seen some younger people with absolutely no underlying conditions that have gotten really sick, and even some deaths. So we're all at risk, and our contacts are high risk. So we're asking that everyone go ahead and get the vaccine to get some protection. You're hearing about variants, and what's happening, the virus is spreading, and it's finding hosts that are not immune, and it's able to mutate or change into a more contagious, more deadly form. So the way to stop COVID in its tracks is for everyone to just go ahead and get vaccinated right now.
Okay, good. If I'm at least 2 weeks out from getting my second COVID vaccine, do I still need to wear a mask?
Yeah, that's a wonderful question. We're hearing that a lot. Why get vaccinated if I still have to wear my mask, right? But you probably saw last Wednesday, the Centers for Disease Control and Prevention said, hey, if you're fully vaccinated and you're meeting with other fully vaccinated people, You don't have to wear a mask for Easter. You could all get together. This is great news, and it's really a big incentive to go ahead and get the vaccine, because we can get together with our family, our friends, our church groups without a vaccine and enjoy each other. Without a mask, because we've had our vaccine.
Right.
So it's great incentive to go ahead and get the vaccine now.
And we can sit socially distanced apart from each other today and do a Facebook Live without our mask, which
wonderful.
makes it a lot better for people to hear.
And you know, we just said the vaccine was 95% effective, so it's not 100%. So that's another reason why, you know, we still want to wear the vaccine. It's a sign of love and respect. So many people haven't been vaccinated yet, so you know, I'm definitely still wearing my vaccine at the office,
Your mask.
Church. I'm sorry, my mask. I keep saying vaccine. I'm still wearing my mask at the office, at church. Whenever I'm not with the people in my bubble, I'm still wearing my mask, even though I'm fully vaccinated, because a lot of those people are not vaccinated yet. But if everybody would go ahead and get vaccinated, we could go without our mask and enjoy each other better.
Right. Hopefully that day will come soon.
Hopefully.
Well, thank you so much for all the information you've given us so far. And now the most important question. We're here today in this building because this is where we're given the vaccine now on certain days. And if someone would like to go ahead and schedule their vaccine, what do they need to do?
Yes, please do. And this is my first time to tour this building, HealthWorks. It's on Industrial Road here in Tupelo. It's a great site. There's plenty of room for us to spread out. All you need to do is just call 1-800-THE-DESK. Or you can go online to nmhs.net, and we'll have that link in the comments of this presentation today. And just go ahead and set the time up. We have some before and after work times. We also have some early evening appointments. If that would be best for you, just go on and take a look and get scheduled. We also like to encourage groups of people to get scheduled. We have appointments 5 minutes apart. So you can bring a group and everybody just get those individual appointments, come get vaccinated. And then some more good news, automatically 3 weeks later, those same slots will be yours. Your group can come get vaccinated. I'd also like to point out, this is not a drive-through clinic. It's actually by appointment walk in. So it's wonderful for people who don't have transportation or who need to make arrangements for transportation. They can actually be dropped off here and then picked up a little bit later. So that's great. And the other thing I'd like to emphasize is we have health professionals on site, and we're going to watch everyone for at least 15 minutes to make sure they're okay after they get their vaccine.
Good. So all the benefits of a clinic, but in a very convenient spot where people can come through and get their vaccine and then go along with their day. Anything else that you would like to add today?
Well, I'd just like to thank you for the time, and I just want to encourage everybody to go ahead and get their COVID vaccine and encourage everybody else to do the same.
Great. Thank you again for joining us today, Dr. Basler, and thank you to everyone who joined us for this Facebook Live. I would like to remind everybody that it will stay on our page, so please like it, share it, so that we can spread the word and get us all vaccinated, and maybe all go mask-free before too long.
All right.
Thank you, and everyone have a great rest of your day.